I'm Dr. Michael Miyasaki, and I practice in Sacramento, California. And I'd like to introduce you to air abrasion, something that we've been using in our office now for about 7 years, and we have found that's been really helpful, not only to us clinically, but to our patients and their comfort. I know what you're all thinking about air abrasion. Air abrasion's messy, and it's a lot of powder all over your operatory. And back in the 90s, that's when I bought my first air abrasion unit, and it was about a 100-pound unit, and it would cast dust all over the operatory. We'd have a big elephant nose suction just to catch all the dust. Today it's different. Danville's got the PrepStart H2O, and with the PrepStart H2O, you have a controlled stream of powder abrasive, and it's encased within a curtain of water. So basically, after you prep the tooth, or while you're prepping the tooth, you just have a slurry of powder that remains in the patient's mouth, and we use that just to suction, and we just suction that out. The nice thing about air abrasion is that we get around a lot of things that the patients don't like the sound, the need of doing an injectable anesthetic, any discomfort. So with air abrasion, what we can actually do is, if we use it often with our pedo patients, even doing a class 2 restoration, I'll put a little metal matrix band between the teeth and the contact area and go in there and prepare the tooth with air abrasion without any injectable anesthetic being used. So we protect the adjacent tooth, we prepare the tooth we need to prepare, we fill it up, and the patient's comfortable throughout. And the nice thing about a pedo patient is that they're not numbed up, they're not going to leave your office and start chewing on their tongue or their lip. Even the adult patients doing a class 5, where you would think that you have to numb a patient up as you restore a root surface, oftentimes we can get up there with air abrasion, clean that area, prepare it, and then bond aesthetic restoration to that area without, again, the need for an injectable anesthetic. So the patients leave thinking that, oh, our office is remarkable, or the latest technology that we're using. I hate to tell them that air abrasion's been around for over 30 years. So we find that air abrasion fits very well into our practice, and I find it very hard to believe that there's other practices out there that have no air abrasion. Even if you start out with a micro-etcher doesn't prepare a tooth as well, but if you're cleaning a occlusal surface out before placing a sealant, you'll get much better retention. If you're cleaning a root surface for a class 5, often I can use a simple micro-etcher to do that. Moving up to the PrepStart H2O just gives us so many different options, because you can vary the pressure, you can vary the amount of powder to water ratio so that you don't have powder being sprayed all over your operatory, and the water is self-contained in the unit, which makes it very easy to move around. So I would highly recommend that you consider incorporating some sort of air abrasion technology into your practice, whether it be a simple micro-etcher or a PrepStart H2O. It's something I think you and your patients will find very enjoyable to use, and will increase their comfort, and you'll have more patients coming to your practice because of that. Thank you.